President Trump is trying to rally Republican leaders to support his health care bill, but critics say millions of Americans would lose their coverage. According to the new Congressional Budget Office report, or CBO, as many as 24 million Americans would end up uninsured on the Trump care plan. KCAL 9's Randy Page takes a look at just who these people are.
According to the Congressional Budget Office, 14 million people will lose health coverage by the end of 2018, and that number jumps to 24 million by 2026.
I think that the numbers sound reasonable.
Professor Gerald Kaminsky, the director of UC Center for Health Policy Research, predicts many in that first group of 14 million who will lose coverage by 2018 will likely be young and healthy, while many of the 24 million who will lose coverage by 2026 will be older and sicker. Here's why. It's all about timing. The new law removes the fines for people who refuse to buy health insurance right away, so younger, healthier people can opt out immediately and will only have to pay a surcharge when they eventually decide to buy health insurance. But the way the government helps you pay for your health insurance doesn't change under the new law until 2020. Professor Kaminsky says people hit hardest financially once the new law's funding mechanisms kick in are those who are older with modest incomes. Many of them, he says, will not be able to afford to buy health insurance because they'll be priced out of the market.
Older people, and generally anybody over 50, is going to be paying more, in some cases a lot more, starting in 2020. And they're going to find it much more difficult to afford insurance.
Consumer Watchdog health policy expert Jerry Flanagan agrees.
If you are 60 years old and you're making less than $75,000 and you're living in Los Angeles, you're going to have a difficult time affording coverage because you're going to get far less subsidies under the replacement plan.
So what will happen to these older people who can't afford health insurance? Well, these experts say they are people who will avoid going to see the doctor until they get very sick. Then they will show up at the emergency room and eventually will likely not be able to pay their bill. At UCLA, Randy Page, KCAL 9 News.